LASIK surgery actually has been shown to have a lower risk of infection compared to contact lens use over time. There is a risk of using contact lenses, and that is you can get an infection from using contact lenses. The thing that's most concerning is many patients will wear their contact lenses overnight or sleep in them. Oftentimes it can be accidental as well. Even patients who use their contact lenses perfectly appropriately, where they remove them every night and clean them, are still at risk for an infection. Fortunately, it's a very small risk with contact lens use and a very small risk with LASIK. However, most patients will end up using contact lenses for decades at a time. So if you compare the numbers, we recently did a meta-analysis at the University of Tennessee that was published in the Journal of Cataract and Refractive Surgery that showed that even with the best contact lens use, after 5 years, there's a 3 times increased risk of infection using contact lenses compared to the risk of infection with LASIK. If you extrapolate that out to 10 years, it's actually 6 times the risk with contact lens use compared to LASIK. Now for patients who sleep in their contact lenses, it's much higher. There's about a 17 times risk of infection with contact lenses that are worn overnight, even if it's just once overnight, compared to LASIK. That's at 5 years. At 10 years, that number goes up to 34 times the risk. So with a one-time procedure, essentially decades of risk of infection can be completely eliminated. The other benefit of the LASIK, of course, is that it makes life a lot easier. Many patients have noticed that their vision is better after LASIK compared to glasses and contacts. And they've actually noticed that the symptoms that they've had of irritation or dryness oftentimes do improve after LASIK surgery. The decreased risk of infection that we found with this meta-analysis, I think, is important data for not only ophthalmologists, but also optometrists, any eye care professional, and especially the population to know about. Many people who wear contact lenses do not know that there's a risk of infection associated with them. And it's important for me as an eye care professional to let the patients know about that. It's important also for them to just be aware that it's not completely risk-free to use contact lenses. I think it's completely inappropriate to sleep in contact lenses overnight. Even if a certain contact lens has an FDA approval for extended wear or overnight use, it's still inappropriate because the risk for infection is much higher with overnight use of contact lenses.